Repair of complex cardiac anomaly other than pulmonary atresia with ventricular septal defect by construction or replacement of conduit from right or left ventricle to pulmonary artery. A cadaver ascending aorta is trimmed to the right length. A tube of artery or dacron is sewn to the valve end of the cadaver aorta. The cadaver artery is connected to the hole in the pulmonary artery. The tube of aorta or dacron is sewn to the hole in the ventricle to close the hole and allow blood to flow through the new valved tube that now connects the ventricle to the pulmonary artery. Repair of complex cardiac anomalies, e.g., single ventricle with subaortic obstruction, by surgical enlargement of ventricular septal defect. The heart is opened and the hole in the wall between the two ventricles is enlarged so that blood will flow freely across it. A baffle is placed to direct blood that flows across the enlarged ventricular septal defect out the aorta. Repair of complex cardiac anomalies, e.g., tricuspid atresia, by closure of atrial septal defect and anastomosis of atria or vena cava to pulmonary artery, simple Fontan procedure. The right pulmonary artery, or left insitus inversus, is exposed from the main pulmonary trunk to the hilum of the lung. The superior vena cava is detached from the right atrium. The atrial hole is closed. A hole is made in the top part of the pulmonary artery and the cut end of the superior vena cava is connected to the hole in the pulmonary artery. Pulmonary blood flow comes directly from the venous system and bypasses the heart. Later the process is completed by performing a Fontan operation. Repair of complex cardiac anomalies, e.g., single ventricle, by modified Fontan procedure. This operation is usually considered to be the second stage of a Glenn repair. Cardiopulmonary bypass with or without circulatory arrest is required. In this operation blood flow is directed from the inferior caval vein, through a tunnel created inside the right atrium to the pulmonary artery. All systemic venous return is diverted away from the heart and directly into the pulmonary circulation. The right atrium is widely opened. A large patch of pericardium or dacron is used for one wall of the tunnel. The lateral wall of the right atrium forms the other half of the tunnel. The tunnel leads from the inferior caval vein, where it joins the right atrium, to the undersurface of the pulmonary artery. The mouth of the tunnel is connected to a hole on the undersurface of the pulmonary artery. Previously, or at the same time, the superior caval vein will already have been directly connected to the upper surface of the pulmonary artery.